Whether you're trying injectables for the first time or making a change to a new provider, the more you can learn about who your injector is before you're in the chair, the better that appointment will be. You're listening to Meet the Injector. Hello, today my guest is facial plastic surgeon Jennifer Levine in New York City. Welcome to the podcast.
Thank you so much for having me. This is really a lot of fun. I don't usually do this with the microphone and the headphones, so I feel like
we try to do it right.
Yes, I feel very fancy.
Fancy? That's not usually a word that I hear, but I'm glad that it's making me feel official and fancy.
Yes, for sure.
Tell us about your practice.
So I am so lucky. I have a practice on the Upper East Side of Manhattan, and I have my very own private operating room. And in addition to doing surgery, I am also the chair of the Emerging Trends and Technology Committee for the American Academy of Facial Plastic Surgery. So I really enjoy being at the forefront of both products and technology that really is going to move aesthetics forward. So welcome to the future.
I'm going to have to maybe do a rapid fire on some of the new technology with you just for fun.
Yeah, we have a lot of stuff.
Yeah, there is a lot. It seems like it was quiet for a while, and then all of a sudden it exploded again.
Yes. Yeah. So there's really a lot of new and interesting technology. And not that I don't love surgery, but sometimes, we need to do some of the other stuff too. I know when it's right to do surgery.
That's so true. Let's start there. I feel like, and I've heard this from a lot of doctors, in the past, we used to wait until we absolutely had to have a facelift. And so we would go from looking kind of old to all of a sudden kind of young overnight. I mean, at least with a few weeks in between.
Sure.
But it's the approach has really changed. And it's more like, why don't you tell me how you think the approach has changed?
Well, I think, what we know from a lot of people is most of the time when people come to my office, they kind of do the universal facelift sign, which is they kind of like take their fingers and elevate their face. So what most patients really want is lifting. And for a while, I think people were seduced by the idea that we could use filler or other techniques to lift, and that really doesn't do it. So if the patient wants lifting, then obviously the gold standard of lifting is a facelift or a neck lift. And a lot of patients, that's what they want. And what we're also seeing is, especially with the rise of Ozempic and people losing weight, they don't want to be overfilled. And also because they have lost weight rapidly, they have laxity to their tissue. So that is where a surgical facelift or neck lift is really going to play a major role. And the patient may not be 60 years old. They may not be 50 years old. So it's really a patient-dependent procedure. But I would say if you're really looking for lifting, then you really need to do surgery.
I like how you say seduced by filler.
Well, it is. I mean, who wouldn't want a procedure that's going to produce instant results and doesn't have downtime, is easy to do? But that's not volume replacement, even though it does create some inflation, because like if you inflate a balloon, things do rise up. That's really not what most people want. And most people do have some volume loss because we know the fat pads of the face start to change in the mid to late 20s. But we want to just replace the volume that's lost and not kind of use volume to create all of the changes, because that's not the only thing going on.
How did you see filler kind of going in the wrong direction?
I think that COVID was the big kind of change. So number one, people were all on Zoom. They were looking at themselves all the time. And most of the time, if you don't have the camera set up quite right and you don't have ideal lighting, your neck looks horrible on Zoom. Your lower face looks horrible on Zoom. So people were noticing that a lot more, and they were looking at their faces a lot more. Also, between COVID and the vaccine, there were some reports of reactions to filler. So I think the combination of those things really let people rethink how they wanted to look. And now, as I said, that we have Ozempic and people are thinner, they don't really want their face. They don't want to look like a bobblehead doll. They don't want this big puffy face and this little teeny tiny body, right? So it has to kind of match. So the idea of this overinflation is just not in style anymore. And even the Kardashians have kind of gone away from those fuller looks to a more natural sculpted look.
I had forgotten completely about the reactions to filler that was from the vaccine. Did you actually see those?
We don't really see them anymore, I wouldn't say, but people did get scared.
So were they just saying, I don't want to do any filler right now until we know?
Yeah, they were saying, I don't want to do filler. What else can I do? What else is there? That's not to say that filler is bad. I love filler, and for a lot of people, it's gonna look great. But for some patients, like more is more, and for filler, probably less is more.
Do you find that people are coming in and asking for their filler to be dissolved or removed very often?
I think in the lips, for sure, that's like an area that we see like filler migration. Another place would be under eye filler, because that area has like a very delicate lymphatic supply and it's a challenging area to correct. And often people need to correct the cheek as well as the under eye, and somehow they end up just with these like blobs of filler that create this little hammock-like effect, because if one of the ligaments isn't supported, it just kind of droops and creates that little swaggy thing, which is not attractive. So those would be the areas that I would say primarily I see people want their filler being dissolved. But really, I think that what I see is more people looking for alternatives or are looking to treat their laxity or their double chin or things in their neck.
Is there something that you're known for in New York City that people come to you for specifically?
I think that I do a lot of treatments on the neck, and the neck has always been my favorite area to treat. So whether it's surgically, and now this is like hot off the presses, there is, we have Emface, and we were lucky enough to be like in some of the earlier studies. So Emface Submentum just launched yesterday. So Emface is a treatment that combines electrical stimulation of the facial muscles with radiofrequency, but the submental applicator does something very, very special in the sense that it helps get rid of fat and also reaches a deeper layer of tissue, which wouldn't even be in a traditional facelift, but in a deep neck lift. And it's able to contour the lower face and neck in a way that's really magical.
Is this Emface, Emface?
Yes.
So it's in the same family as Emsculpt and
Yes,
Emcella.
correct. So it's by the same company. It's by BTL. But the applicators for the face, there's one for the forehead that targets the frontalis muscle, and then one for the cheeks that targets the zygomaticus major, minor, and rosaris muscles. And these are muscles that elevate the face. Now, these applicators do not destroy fat, and they're going to increase the density of the facial muscles. So it's not going to make your face thinner. If anything, it's going to add volume, but more to the cheek. And even though it's contracting the frontalis muscle, it's not doing it in the same way that you would if you were exercising, because it's not a skeletal muscle. What it's really doing is it's increasing the myocytes, and it increases the density of the muscle. So what that does is it actually shortens the muscle and the envelope around that muscle, and it makes you contract the frontalis less and elevates the eyebrow, so you don't even need to do that as much. So it reduces wrinkles and elevates the brow. So you could I actually have some of my own pictures on Instagram, so you could see some of the results of this treatment, because we just posted it yesterday, so it's easy to find.
I was already there.
Yeah.
I'm going to put it on the screen so we can just talk about it a little.
Yeah. Yeah. So look at that. So look at the improvement in that lower face and jawline from a non-invasive, no downtime procedure.
So you're not taking anything out or putting anything in?
No. So this is using the cheek applicator and also the submental applicator. But you could see the big improvement in the contour of her lower face. So this is after 4 treatments. Each treatment is 20 minutes. They're spaced 1 week apart. And there's no downtime, no pain, no bruising. So yeah, it's magic.
So let me throw an analogy at you and see if it flies. If you can tell me if this is completely stupid, but sometimes when I think my arms look saggy, I'm like, I got to go get back in the gym and build up my biceps and my triceps so that my arms
Mm-hmm.
don't look so saggy. Is that kind of the same thinking?
Yes, but we also have to treat, even if you treat the muscle, you also have to treat, like if there is fat, you would have to get rid of fat, and you also have to tighten the skin. So this is kind of doing all of those things.
Wow. Is it affordable?
It's affordable, yes. Yes.
Yeah, it's not like neck lift surgery.
No, it's not like surgery, but
Right.
it's not inexpensive.
No.
Like depending on where you are in the country, like you have to do 4 of these treatments. So I would say the price for each treatment is going to range between $1,000 to $1,500 per treatment, and you have to do 4 of them at least.
Have you done this to yourself?
Of course.
Of course. What does it feel like?
So this cheek applicator, you kind of feel some just contractions, like you could feel like the muscle contracting. With this one, you feel like a little bit of pressure and some tingling, but it does not hurt. It just feels weird.
This is amazing.
Yeah. So that's hot off the presses. So this is what's really new.
Okay, so when you say it just came out yesterday, what does that mean? Obviously, you've had it for a while.
That means it officially launched. We've had it, but the company officially launched it because before we had it, but we couldn't talk about it. So now we can talk about it.
What other secret things do you have over there in the lab?
Oh, secret things. Well, we're doing a lot of stuff with regenerative medicine. So that's another thing that is a big topic. So we know that there are products that make our body be younger. So unfortunately, aging is a pathological process. It means that things are not going the way that they used to. So our body kind of forgets to make collagen, and the collagen that it makes is not the same as when we're younger. But we know that in order for tissue to really be regenerative, it has to contain all of the components of normal, healthy tissue. And collagen alone is not enough to stimulate. So collagen is something that gives firmness to the skin, which we also find in scars. So no one wants a bunch of scars, right? That's not what we want. So we want collagen, we want elastin, we want proteoglycans, we want angiogenesis, we want a lot of other things. So we're really looking for products that are going to do more than just produce collagen, but produce these other things that really make the tissue look like normal, healthy tissue and behave like normal, healthy tissue. And that's the criteria that we need to be able to use the concept regenerative. Otherwise, the concept that we were using before that would be biostimulatory. It's making your body produce collagen. But as I said, that's going to give firmness. So we don't want just that. That's not enough.
How do these things work? Are they skincare products? Are they supplements? What are we talking about?
So there's all different ones. There are ones like exosomes that could be applied topically. There's obviously supplements that can help. And there's injectable products. And then there's a concept of skin priming, which is really to combine these together, to combine the regenerative elements. So there's a lot of stuff, and we're just really scratching the surface of what we can really have our bodies do. But certainly that's what we want. We want to regenerate the tissue, and we want to regenerate it on all levels. That's why it's so important to treat the muscle, to treat the fat, to treat the skin, to treat all of the layers, because our body is composed of all of these things. So I think we need to do all that. And I think the other thing, what we should say is that you need to have, in order, if you're going to do regenerative procedures or if you're going to have surgery, your body needs to heal and make collagen and these other things. So it needs the stuff it needs materials. So you need to make sure you're eating a healthy diet that has proteins, because protein is what collagen is. So it's not the same thing. So if you drink a collagen shake, your body doesn't absorb it as collagen, because collagen is a very big molecule. So once it gets to your gut, it gets broken down into smaller pieces, and then that's how it gets absorbed. So collagen is good in the sense that it still is a protein, but it doesn't get absorbed as collagen. So as long as people who want to do regenerative procedures or want to have surgery need to make sure that they are eating a healthy diet. The other thing that's important for collagen production would be vitamin C. So people need to make sure that they have this stuff available. Otherwise, your body is like kind of out of materials. Your body's like, yeah, I'm ready to go, but there's nothing to build anything with. So I think assessing a patient's nutritional status, and also if you're going to do any of these devices, also hydration is important. So making sure that you drink enough water, that you have all the trace elements that are needed. Those are things that are going to maximize your results and give you, your best result possible. Because obviously, this is an investment. It's an investment of time. It's an investment of money. So we want to, if we're going to do that, if we're going to work together, we have to make sure that we are doing all the things that are going to make this have our best results.
And like the Emface, what you tried on yourself, do you try all these, pretty much everything on yourself?
I wouldn't do anything to a patient without knowing how it was on me.
So give us a little window into what you use every day or every week. Like, what does that look like?
Oh my goodness.
It's a long list.
So obviously, like, skincare is really important. So I only like to use medical grade skincare. So I do that like twice a day. So I like the TNS Advanced Plus. Right now I'm using a vitamin C serum from Elastin. And then because it's so cold, I am using a SkinCeuticals triple lipid cream for some added moisture. And then I put on like an Elastin tinted sunblock, and I use the Skin Medica Neck Correct for my neck. So that would be twice a day. I'm doing all of that stuff. Then I take Nutrafol every day. So I take 4 of those vitamins every day. I work out every day.
What do you like to do at the gym?
So I go to this gym that's near it's called SLT, Strengthen, Lengthen, and Tone. It's like a Pilates-based class. It's on a machine. It's called a Megaformer, but it's like a reformer. So it's a series of exercises on that. So it's 50 minutes. So I do that every day.
I know in New York City, you always get the most amazing new things first. Or actually, sometimes it's old things repackaged and in new packaging, and they come back around.
Yeah. So this is like a really good for your core. It's really good for balance and just overall like strength. And
yeah. I was just downtown the other day in Austin, and I noticed that we have a Barry's, and I was like, oh, look.
Oh.
That finally made it here.
Yeah.
Finally made it all the way down.
Yeah, there's a Barry's that's not far from me either, but I've gotten so used to doing these other classes that I don't know if I could switch to Barry's.
Yeah. I don't know. These days, I just go to the YMCA with my kids.
I think you just have to do whatever works for you. It's not what you do. It's just doing it regularly. So if that works, then I would stick to that.
Yes. Doing something is always better than not doing it.
Just do anything.
So what else is on the horizon? Do you have any other sneaks for us?
I think that's like most of the heavy hitters. I mean, the other things are not like, microneedling or RF with exosomes. Like there's just a lot of those, like combining like hyperdilute radius with other biostimulatory products for collagen and elastin formation, or combining those with like microfocused ultrasound, which is all therapy. It's kind of combining all these procedures together because, as I was saying before, now that people are really losing a lot of weight, laxity is the main problem. So getting the skin to kind of contract and get its elasticity back requires a lot of work. So it's a combination of using things like Emsculpt Neo with some biostimulatory fillers, with exosomes or other peptides or hyaluronic acids, like those types of things, kind of like all together.
You said hyperdilute radius. That's the second time I've heard that this week, and I've never heard it before. What is going on there?
So Radius is a product that is calcium hydroxyapatite. It's a volumizing filler. It has the highest G prime, meaning it gives the biggest lift of any filler that we have. But we know that if we start to dilute the Radius with even saline or lidocaine, it has less ability to lift and more of a regenerative potential. So when we use it in a dilute form, it's going to cause the body to produce the collagen, elastin, proteoglycans, and angiogenesis. And it does that through direct contact with the fibroblasts. So it's not doing it through an inflammatory response. These particles, which are calcium phosphate particles, which are naturally occurring substances in our body. We have calcium and phosphate. right? That's like what's in our bones. So it doesn't really cause an inflammatory process, but it reacts directly with the fibroblasts and causes it to produce this collagen and elastin and these other components of the extracellular matrix over time.
Radius was always the like sort of go-to for hands when your hands started to look old. So
yes, we have this meeting that's called like Mexis, which is MERS, the company that produces Radius. So that was one of my talks, was like kind of using hyperdilute Radius for the hand. I also was lucky enough to go to Brazil, and there's some great protocols for both the abdomen and the butt using the hyperdilute Radius. They are amazing. They're published. So anyone could like look them up. They're in PRS, plastic and reconstructive surgery. Amazing protocols from my Brazilian colleagues, really showing amazing, amazing results.
Okay, well, this was supposed to be about you, but we've talked about technology the whole time. So let's pivot and let's find out a little more about who you are. I know obviously you love technology and the science behind it, and you know it inside out and upside down. Give us a little on your training and your background. How'd you end up in New York City? Have you always been there?
Oh, I was born there. So that made it easy. So I'm originally from Brooklyn, but now Brooklyn is really cool. But when I grew up in Brooklyn, it was like not cool. It was kind of like, my high school was filled from the characters from like My Cousin Vinny. Actually, Marissa Tomei, we went to the same high school, not at the same time, but the fact that she got an Academy Award for acting like everybody else in my high school is like unbelievable to me. For being herself. I'm like, I can give you 12 of those people. Like, that's not acting. That's like real life. So I grew up in Brooklyn. And then, so I went to a very large, like public high school. There were like over 700 people in my graduating class. So it was like a big school. And I graduated number one in my class. And I then went to Columbia undergraduate. And then I went to Cornell Medical School. And then I did my training at Manhattan Ioneer and my fellowship at NYU. And here we are.
It's actually pretty unusual to not leave New York when you're in training anyway.
I really tried. So it's very interesting because I did not learn how to drive when I was in high school because I graduated when I was like 16. I wasn't even 16 yet. So I couldn't take driver's ed with everybody else because I was too young. So I kind of like missed the boat on the whole driver's ed thing. And then I was in college and when I was in medical school, I was like, wow, I'm going to really have to maybe live in another city because residency is a match. You don't get to pick where you're going. They kind of tell you. So I learned how to drive because I was all sure that I was going to be going to a different city. But I matched somehow in New York. So then I did try to go. But now I'm here.
And so going through medical school, do you remember how many women were in your class versus men?
Yeah, so it wasn't so bad. So there were 101 people in my medical school class. And I would say it was probably 45, 55. Oh. And now it's like maybe 55, 45. So there's plenty of women that are we're creating doctors. We're training doctors. So now in these residency programs, like, okay, in surgical residencies, there's just not a lot of women. So when I did my surgical internship, it was me and 20 men. Literally, I was the only woman, and there were like 20 men. And I was like, am I in a Twilight Zone episode? And that was really weird. And I had never really, even in medical school, it wasn't like there was not women. So it was very confusing to me. And I didn't really realize how it worked. But even now, only 10% of academic chairs are women in medicine. And women are just, they're not quoted as much in media articles if they're quoting surgeons. I'm not talking about dermatologists. Dermatology, they do tend to still stick to women. But for surgeons, like they maybe talk to women like 30% of the time. They're not on podium as much for surgery. They're not, editors of the main journals. So there's like a cliff that women kind of fall off after training.
I wonder who would even want to be an academic chair. No,
there are people who would, but I'm saying like, why would it be only men?
Yeah, I don't know. My thought was, we do this I'm not a doctor, just to be clear, but we're trying to take care of people. And so the further away you get from taking care of people, like doing academic work or administrative work.
No, I don't think so. I think there's a little bit of a double standard. And that's what women are told to think, is that we have to spend our time caring for other people all the time. And that's our main job. And as a result, we can't do this like other stuff. Right?
Yeah.
Because because it's our responsibility to care for other people, whether it's caring for our patients, caring for our families, caring for our children. A lot of caring is going on there. But I don't think that certainly does make things more convoluted, but there is some sort of glass ceiling that's still.
Yeah. Were you treated differently when you were the one of the 20 or 21?
Oh, yeah. I mean, I was like, what is going on here? I didn't realize that people could be so sexist. Because when you're in school, you're in a more like protected environment where they try to behave appropriately and at least pretend that they're not like that. But especially when I train, and there's no recourse as a resident. Like, it's not like you have a union or you have someone to go to say like, oh, this isn't fair. I didn't like this. there's no one to talk to. And if you do complain, then you're just like a complainer or a problem, right? So it's just like, kind of like, suck it up and do your job.
But you made it out of there.
I did. I made it out. One piece.
What about after training? You where did you land when you were finally out on your own? Like, go be a doctor now, Dr. Levine.
Right. So I was not enamored of being in academic medicine because I could kind of see the writing on the wall that it was going to be a very difficult journey. So also, when I was in medical school, C. Everett Koop, who had been like the Surgeon General at the time, had come a couple of times to my medical school. And for some reason, like, I was always like the designated person that got to like speak to whoever the guests were or like give the speech in front of whatever it was. So I got to spend like I've met with him a couple of times and got to speak to him about the future of medicine. And at the time, they were talking about like the Hillary Clinton plan for socialized medicine. And I was like, that is not for me. I'm like, this medical school stuff is really hard and I'm working really hard. And I don't want the government, like, how could the government possibly understand medicine or dictate how I should practice medicine when it was very hard? So I just said, whatever I'm going to do, I am not going to be under the influence of the federal government. So that's why I went into private practice.
So you did that right away?
Yeah.
Bold.
Yeah, but because the writing was on the wall. So it was kind of like, pay me now or pay me later.
Yeah.
So I'm like, at some point I knew that this was all going to come to a head and everything was going to go not the way I wanted to. So why would I want to wait 20 years and then be like, oh, I don't want to do that. So I decided to just like start out that way from the beginning.
Was someone or anyone in your family entrepreneurial?
No.
Huh.
I mean, I would say that the only person could be, and I never met her, would be my great grandmother. My father's grandmother was a business person. And she came to this country maybe in like 1920. And she set up like, it was like candy and tobacco. And then they had sporting goods. And she set up that business.
In Brooklyn?
In Brooklyn. So she was obviously entrepreneurial, but I never met her because she passed away like when I was like 1 year old. So I never met her, but she definitely was a business person, but I didn't meet her. So maybe it's some genetic thing.
So do you still go over to Brooklyn to visit or you just stay on the Upper
sure.
East Side?
My parents still live in the same house.
They do?
Yeah. My sister lives in Park Slope. So I was just there on Friday. So, Yeah.
Well, if someone's listening today and they want to reach out and potentially either make an appointment, schedule a consultation, or just follow you online, where should they look for you?
So they should follow us at drjenniferlevine.com or Dr. Jennifer Levine on Instagram. They could DM us or send us a message. And if they want to call us on the phone, it would be 212-517-9400. And we'd love to hear from anyone or send us a DM we love to meet new people.
We'll make sure we put all those links in the show notes so it's easy to find.
Thank you.
Thank you. It was a pleasure getting to know you.
Yes, it was a pleasure getting to know you too. Thanks for having me.
There's no substitute for an in-person appointment, but we hope this comes close. If you're considering an appointment with this provider, be sure you let them know you heard them on the Meet the Injector podcast. Check the show notes for links, including the Injector's website and Instagram to learn more. Are you an aesthetic injector or do you know one? You can be a guest on Meet the Injector. Book your free recording session at meettheinjector.com. Meet the Injector is made with love in Austin, Texas, and is a production of The Axis, TheAxis.io.